Hi, I'm Eugenia Flood, and I will be doing an NG tube insertion today. We'll start off checking the doctor's orders, making sure the doctor orders are in place. We check the orders are in place. Then we will get all our supplies together. We have a basin here, we have tape, and we have lubricant here. And we will use one of the lubricants as a pH strip when we go to verify that the levels are good. We have two pieces of tape here already prepared. We have a pen light. We have a suction, a syringe. We have sterile gloves. We have the chuck to protect the patient. Some hand sanitizer, washing hands liquid. We have the NG tubing. We have a cup and a straw for the patient and a towel as well. All right. So the next thing we'll do is we'll go and enter the patient room and educate the patient and introduce ourselves to the patient as well. Knock, knock, knock. Walk into the patient room. We close the door and we pull the curtain for privacy. Hi, Mrs. Flood. My name is Eugenia. I'm your nurse today. How are you doing? Good. Okay. Well, can you verify your name and date of birth for me? Layla Flood, 3/21/21. All right, so we're matching it to the wristband. Layla Flood, 3/21/21. Thank you. Okay, so I am here because your doctor had ordered for you to get an NG tube placed. So what that means is that we have a tube that will go insert into one of your nasal cannulas to go down your throat into your stomach. This is more because you complain of pain, so he feels like the NG tube will help, release some of that pain by suctioning some of the acid out of your stomach. During this procedure, we will lubricate the tubing so it can go down smoothly. And then we will have your head to be hyperflex. So as we insert, as you insert and you get the gag reflex, I will bring you back into a high Fowler position and have you sip water as we continue to move the tubing down. Once that is done, then we will make sure it is placed correctly by having an x-ray come and do an x-ray and check to make sure everything is placed and going good. Is that okay? Do you understand? Did you need any, did you have any questions for me? Okay, all right, good, no questions. And is it okay if we continue moving forward with the procedure? All right, so we'll get started, okay? All right, so we're gonna do some hand washing or hand sanitizing. Then we're gonna put on our sterile gloves. All right. We're also going to make sure that the patient is in a high Fowler position and comfortable. You're okay? Doing good? All right. And then, so now what we're going to do is we're going to take our pen light and we're going to look in the nostrils, checking each nostrils, making sure there is no obstruction, no sores, no open sores. All right. Everything is nice and pink and moist. Then the next thing we're going to do is we are going to have the patient check the flow of each nostril, airflow of each nostril. So we will have the patient cover the left nostril and blow out of the right one. Okay, good job. Then we will have the patient cover the right nostril and blow out the left one. All right, thank you. So we will work from the left nostril due to video recording. All right, so now we will gown the patient to protect the patient with the chuck. Okay, and then we will get our tubing and do some measurements before inserting. We will take the tip of the tubing and we will go from the tip of the nose to the earlobe of the patient. And then we'll bring it over and bring it down until we get to the side floor, which is here. And the measurement is reading 55. Once we have our measurement, we'll take our small piece of tape to mark our area of stopping. Once that is done, okay. Now I'm gonna explain to the patient again. Mrs. Flood, I am going to, once I start, I will have you hyperflex your head. And then, like I said, when you tend to get a gag reflex, I will hand you water and then you will sit for me so we continue moving the tubing now smoothly, okay? All right. So we're gonna take the petroleum jelly and we're going to lubricate. And then once we're done lubricating, we are going to have the patient hyperflex their head and we're gonna start insertion. Patient is gagging, so we will bring the patient back up to a high Fowler, hand the patient a cup of water with a straw, and have them take sips as we continue inserting. Sip, 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 sip. Are you okay? You doing good? All right. Sip, sip, sip. We are almost there. Sip, sip, sip. Sip, sip, sip. All right. Great job. You did really well. Okay, you doing good? Okay. So once we have placed that, we will contact X-ray, and X-ray will come in and check the placement, making sure that it is placed well in the stomach, no obstruction, and nothing went wrong with that. In the meantime, we will remove the top to the suction, and we will insert our syringe in here, and we will pull back 10 cc's of gastric fluid. And then we will put it in our basin. We will put the top back on our suction. And then we will take our pH strip and we'll dip it into our fluid. And then we will read it, and it reads 3.5 to 5 point pH level. All right, so the X-ray technician had verified that the tubing is in the correct place. All right. How are you doing, Mrs. Flood? You doing good? All right. So now that the tubing is placed in the right into the stomach and is verified, we're going to take our piece of tape and we're going to make sure that we attach the tape around the tubing, securing it to the nose area. Okay, now we're gonna remove the head of our tubing and hook it up to the suction flow. And then we're gonna take our safety plane and we're gonna clip the tubing to the patient gown. And then we're gonna monitor our suction every 2 hours, making sure the flow is good, watching for the content that comes out of it. So that's that. Now we're going to educate the patient. Okay, Mrs. Flood, you did really well. So just to inform you and some education, when in bed, we would like for you to stay in a high Fowler position. We don't want you going any lower than that because you can have a risk of aspiration, okay? So make sure you stay in this position as you're laying in bed and don't go no lower than 30 to 45 degree angle. You understand? All right, so I'm gonna get you all nice and cleaned up here, okay? We're gonna remove the chuck from you. How are you feeling? Good? Good, okay. Any questions for me? No? All right. So now we're gonna put the patient in a low position, bed in the lowest position, and we're gonna give the patient their call light. We are going to clean the area up, removing the gloves, hand washing. All right, Mrs. Flood, so we'll check on you in a little bit to watch the suctioning, okay? All right, so we're gonna exit the room, and when we exit the room, we are gonna document the suctioning, the content that's coming out of the patient, and how the gastro exit is looking, the color, and we're also gonna document how the patient handled the procedure and the reaction, and I believe that is it. All right.